Hello, Dr. Dane Ives here from Steinway Family Dental Center. We get a lot of questions about dental implants. So today we're going to answer some of those most common questions that we get. The first question is, what is a single tooth replacement implant and how is it different from other types of teeth replacements? Well, first of all, implant does not require us to touch any other teeth. If you're missing one tooth, then hopefully you have enough bone support in there, and then we would place an implant, which is basically a screw that replaces the root of the tooth. There are other two parts that will replace the rest of the tooth structure, and so you can have a tooth, but implant goes inside the bone and it supports the crown portion of the tooth. That's what you do see. You don't see the implant because it's inside the body. And like I said, it does not require any attachments to this adjacent teeth. So the teeth are touched only so you get support for the gum underneath, so no food will get through. If you're getting any other supporting things, for example, you can get a 3-crown bridge to replace one tooth. It would require that you get a crown and a tooth on the right and on the left of it, or in front and in the back of it, and that will hurt that will hold the tooth in the center to replace the missing tooth. So that is the second option. Instead of an implant, you can get that. The third option would be that you get a removable denture that will be supported by the teeth around it, and it would be replacing the missing tooth. Now, the downfall with that is that you have to take it out at night, right? So, and it's a loose item in your body. I don't think it's really convenient to have something like that. The next question is, can you explain the full process of placing of the implant from beginning to end? And the first step would be, of course, if there is a broken tooth, that tooth would have to be removed, right? And this is the tooth that would be replaced by placing an implant later on. But the first thing is removing the broken tooth and clearing the site, grafting it. Sometimes it could be replaced by an implant right away, right? So in the same day as you remove the tooth, you would get some bone grafting and place the implant at the same time, and that would be done by your dentist or by the surgeon. Once the surgical thing is complete, the surgical process, then you can have the tooth usually uncovered and then placed a special abutment that is for healing and creating the gum, the soft tissue, like a wale around it. And once that is happening, then you can have the second part that screws into the implant and then holds the crown, and then you would get the crown. Now, so those are the process of it. How much time does it take? Depends whether they can place an implant on the same day of the extraction. If it does, then it takes less of a time. Within 6 months, you can actually load that implant. You can put a tooth on that or a crown. If you have to separate the procedures, then it has to be at least 2 to 6 months, depending on the healing process. How long will it take before you place the implant, and another 4 to 6 months until you actually can put a crown on the implant. The next question is, what is a bone graft and when is it necessary? Whenever you're pulling a tooth, there is enough bone support. The bone is really wide around that root of the tooth, right? We have bone in front and in the back if it's a front tooth. If it's the side tooth, you have on the cheek side and on the palate, or the cheek side or the tongue side, right? So on either side of that root that needs to be extracted, there is enough bone. However, when you pull the tooth and you don't replace the bone will fold into the hole, and you would lose up to 40% of the bone height, which is impossible to get back. So in order for you not to lose that, because you do need the height of bone, right? Because implant is basically a screw, and you need wood to put the screw into. It cannot be held in the air. You also cannot put it halfway in. It has to go all the way in, and then you would put a crown on top of that. But you need the width of bone and the height of bone, right? So there is sufficient amount of bone, and for that, when you pull the tooth out, you need the bone grafting material. Now, the graft itself can come from different places. It could come, could be synthetic, could be natural, could come from you or not from you. And this bone grafting material is placed in the socket or in the hole that used to hold the root. and it could be done at the same time as you pull the tooth. It should be done at that time. That's the best time to do it. Or you can always do it later, but it is a lot more difficult for the body to accept it if it's done later. The next question is, what should patients expect in terms of healing after the implant is placed? Most people are afraid of it, like they don't like dentists, they don't like drilling into the bone, they thinking it's going to be very painful. The truth is, it is almost not painful at all. It feels the same way as you would feel if you remember when you were little and the baby teeth start moving and you feel like a little twitch in your gum. That's how it feels. And you're supposed to keep it clean, like brush around it, and it's gonna go away pretty fast. Now, do you have to take medication for it? Well, listen to the doctor, because each case is slightly different, but a lot of times you don't really need to take medication and it's going to heal. Definitely not painkillers, but the doctor may want you to take some antibiotic, depends on condition of your mouth otherwise, other than the area where you're placing the implant into. The next question, what are the benefits of single tooth replacement with implants? And the best benefit is that you're replacing the teeth that are missing. That would help you to preserve the bone around it, and you would load it and you would use it just like your own tooth. The other benefit is there's no way to get decay in the implant, right? So, because it's not an organic structure that can decay. So that's the benefit also, and it will look cosmetically decent, so you look like you're not missing any teeth. So I think that is an excellent product. The next question is, how can a patient find qualified implant dentist? Well, of course you will just look at the dentist near your location, depending on where you're looking at this video from, and see, just Google dentist near me or implant dentist near me, and that will give you some ideas. You can also look at, ask your dentist, the one that you already have, if they place implants or if they work with somebody who does. And of course, if you can't find anybody, you can always call us here at Steinway Family Dental Center. You can either call me on the phone, which is 718-728-3314, or find us online at alldentalneeds.com and request an appointment. And then we can look together at your x-rays and see whether you need an implant, want an implant, or how it would benefit you personally. And then we would give you some prices on it, tell you what we can do for you, and then you can make your decisions. The next question, how much is a dental implant cost without insurance? Well, the cost of a dental implant usually divided into 3 categories. And in each category there is also some differences or subcategory. Number 1, what's important is the place where the implant is going into. Like, does it need bone graft or not? Because that can increase your price, right? Or decrease your price. The brand of the implant and the surgeon that is using it. So based on all of that, I would say the most expensive implant is the one that you don't need, right? So the best price would be going to see a dentist. On average, the implants would be just for the surgical part of it, meaning just to place the implant without anything on top of it, would be between $1,500 to $3,500, depending on where you're getting it done. Where in the country or who's your dentist. The replacement of the rest of it is basically the fee of the crown and the fee of the abutment, part that connects crown to the implant. So that's how it's collected together. The next question is there a significant difference in price between the single tooth implant and other options, like the options that we discussed in the previous questions, whether it is a fixed bridge or removable appliance, what would be the difference in it? And yes, there is a difference. Of course, the placing of an implant could be equivalent price-wise to getting a 3-crown bridge, and the denture, of course, is less expensive, like removable denture is less expensive, however, it's also less comfortable. And it feels like it is a solution for last century. In the new century, there are very few people who actually want to get a denture for that, especially for one tooth. The next question is, how can I find out if I'm a good candidate for single tooth implant? Well, number one, are you missing a tooth? Or are you about to be missing a tooth, right? And number two, of course, you do need a dentist for that. So either contact your dentist, or you can come in here and we can help you out with whatever questions you have about that. So again, you can call us at 718-728-3314 and request an appointment for consultation, and we can discuss what you need, what you want, and how it could be achieved. Or you can simply go online on alldentalneeds.com and request an appointment. I hope I helped you to make up your mind and make up a decision, or give you some light on this particular subject. So if you have any further questions, again, you can contact us, come in, and we'll help you further with that.